welcome. My name is Jen Boyd. I'm the Advocacy Director for the Tahoe Regional Young Professionals. I want to thank everybody for taking their time to be here. And this is an unprecedented event for us. We are live streaming. So we are testing that out to our members as something new, something we're trying, and it will be available on YouTube afterwards, but the component that won't be there is the question and answers. So we want our workshops that people can get more information and learn what we discussed, but obviously the engagement part, we want you here asking the questions. So we're looking forward to seeing how that works. So a few housekeeping announcements real quick with Trip is this is our last workshop for the year. Woo! We take off in November and December, so we will be back with a great schedule in the new year, so pay attention. Our workshops are the third Wednesday of every month from about 6 to 7. This one is expanding a little bit longer because we have a lot of great topics we want to address. So the format, we're going to have about an hour, a little bit less than an hour from our panelists, and then we'll go to question and answers. So I do want to introduce our moderator, which is also unprecedented for a Trip workshop. So we are very grateful that we have Dr. Matthew Wong with us, good friend of ours, and really glad to have his expertise here. He is a psychologist specializing in the neuropsychology and emotion development of children. He is a clinical supervisor in an inner-city children's agency, consulting specialist in psychology assessment, and contracting staff member in a multidisciplinary team setting. Those are a lot of words, but he does a lot. He maintains a private practice in Menlo Park, and he's also just opened his business here in town with a couple different partners. It is called Tahoe Summit Solutions.
Therapy Solutions.
Sorry, Summit Therapy Solutions here in South Shore. So we really welcome him, and he's going to introduce all of our speakers, and so we appreciate your time, and thank you very much.
I am, huh? Thank you. Thank you to Trip for inviting me here tonight. I'm really excited to be a part of this conversation. And also, thank you for the panelists for being willing to put yourself out there. And I certainly stand in awe of the work that you're doing in the community and really look forward to hearing more about the work that you're doing already. I don't have a preparation or a introduction prepped, so perhaps I can pass the mic down and everyone can kind of introduce themselves.
Sure. Hi, good evening. My name is Betsy Glass. I'm a licensed clinical social worker for Barton Hospital System, and I'm currently working at Barton Community Health Center and Barton Family Medicine, providing psychotherapeutic services for folks experiencing mental health concerns. And this program was introduced about a year ago, actually. It's Barton's initiative, wellness initiative, following community health needs assessments that indicated that our community could highly benefit from additional mental health services. So I'm also excited and grateful to be here this evening, so thanks for having me.
Good evening, I'm Sabrina Owen. I'm the manager of mental health programs for the county. I operate the South Lake Tahoe Clinic, and I come with many, many years of experience in working with difficult to treat populations, and I specialized in treatment failures. So that is individuals who failed other means of treatment with other providers. I will just say that at one point, one of the people that I worked with had gone through 20 different psychologists and therapists before they got to me. So I have a little bit of experience in working with some harder to treat populations, and came to Lake Tahoe to take on the challenge of county mental health, which has kept me busy and taught me a great many things about working in a clinic setting.
I'm Cheyenne Lane. I'm the Supportive Services Coordinator for Tahoe Youth and Family Services. I've been there for 10 years. I work I do direct care and case management for runaway and homeless youth. They are usually between the ages of 16 and 24. We have offices, and I work out of the offices in Gardnerville, South Lake Tahoe, and Alpine County.
Fantastic. Thank you. I think that it probably makes sense to open with a bit of an overview. I've got one on me, thank you. So keep that in the middle there. About just the prevalence of hardship, I think, within the community and also within the nation. So according to the National Institute of Mental Health, as of a couple of years ago, 2013, there were about 49 million people, 49 million adults actually, who experienced some form of mental illness, 10 million of which experienced a serious mental illness resulting in significant functional impairment, which seriously impacted the way in which they engaged in their lives. And I think that we're probably going to be talking a bit in generalities here today, but I'm going to say that's probably not a stretch to say that many of us here in the room have been touched either directly or indirectly by some aspect of mental health, whether it's personally or a family member or a friend or whomever. I've certainly had my own battles with social anxiety, and I find it a bit ironic that I'm standing here, or sitting as it were, doing some public speaking, so thank you. So I guess to our first topic here, the question about the media. So in the media, it seems that mental health becomes kind of an issue around crisis, around a school shooting or a suicide or community violence, actually. So how is mental health seen here locally? And how has the conversation either paralleled what's kind of prevailing in the media or diverged from it?
I think nationally we tend to respond to situations after they occur, and I think that's society-wide. I think not only nationally but probably internationally. So, but I find that in our community in the past 5 years, I think we're really trying to take more of a proactive and preventative approach. And I think that began with the community needs assessment back in 2012. Where it indicated that mental health, substance use, and access to services were the greatest need in our community. And I think since then, there has been a push collaboratively with all the community organizations and foundations and community members to really address the mental health concerns that were either stigmatized, unrecognized, or weren't addressed because of the lack of services and lack of accessibility. So I think in the past, going on 4 years now, or even prior to that, because the results came out in 2012, probably about the past 5 years, we've really been exploring what our community does need and how we can address it through a proactive and preventative standpoint within the collaboration of the community members and agencies.
And have you found that to be sort of different than kind of the national approach? Do you think that's kind of unique about Tahoe in a way? Sorry to.
That's okay. I was trying to get out of it. You know, in a way, yes. But also, I do believe that we are nationally recognizing and internationally recognizing the needs of our community members. I would hope to think so, at least. So I think in a way Tahoe is taking an approach very similarly to that of our nation and trying to be more proactive and preventative. I don't know that that's always the approach that we have taken, but I have a feeling and believe that's the approach that we're attempting now.
Great, thank you.
Can I just want to speak for a moment on something that we call the contagion effect. The contagion effect is when something is publicized, usually media, and then we see what we call copycats. The contagion effect is definitely a problem with suicides, and it's a problem with the school violence and the workplace violence. Individuals who are having those thoughts, considering those behaviors, see that on the media, and it's somewhat glamorized. And people tend to act on it, which is why last week when we saw 2 additional school shootings after the following college school shooting, I was not at all surprised, because that's what I would expect. Adolescents are very prone to the contagion effect. It's not only seen with suicides, but actually following suicides, there's a correlation in automobile accidents that correlate with a suicide, or if there's a suicide homicide, the automobile accidents include a family member. So the contagion effect what we know is it's already seen in suicides, and what is underreported is the automobile accidents that are in fact suicides or homicide suicides that are also correlated, but don't get registered as suicides or homicides. They look like a car accident. And in fact, that's exactly what they are.
So these are people who are intentionally getting in an accident, or
They are intentionally killing themselves using an automobile, or killing themselves and a family member or a spouse, directly correlated with media exposure on suicides and workplace and school violence.
It's a very interesting statistic, actually. Thank you for sharing that. And I think on the flip side of that, not talking about suicide is why we're all sitting here. So I'm sure there's bound to be, and perhaps we can discover this balance between the contagion effect, but yet also outwardly speaking about this incredibly serious topic that is often avoided or stigmatized.
So I'm not saying that we shouldn't talk about it. I'm absolutely saying that we should talk about it. We just have to be careful about what we are showing on the media. We started, way back with Columbine, and in order to get that type of media attention now, you have to go bigger and badder. And that's the area in which we have to be mindful. Sharing the details of the shooter or the manifesto, again, reinforces that type of behavior, so we have to be very careful. I think we can use the media when we do have a suicide, whether it be in our community or nationally, to promote education about suicide, about mental health issues, about isolation, about the things that contribute to these behaviors. As a matter of fact, if we do know someone who is struggling, reaching out to them is a huge preventative insofar as them going and acting on any thoughts that they may have.
And then just on top of that, we just had a case that was in the newspaper recently about a young gentleman down in Gardnerville that had ran away from a group home and had threatened to go to the school and kill the kids or shoot up the school or whatnot. And the kids that we see that were going to that school, when they came into our drop-in center, they were talking about it. And so I think we need to talk to them, and we have to explain what's going on and why this kid is doing it. We have to provide preventative measures to these young people, especially, I think, to talk about why they're doing this, how it got to this point, and how it should not be glamorized, because you will get the young people that they get very drama about it. Like, it becomes very dramatic. And so you got to hit it head on. You can't let it fester, and you can't let it wait. So talking about suicide and talking about school shootings is a very serious topic, and it has to be addressed head on.
I know that I personally got texts and phone calls the evening that news report came out of kids in this community that were telling their parents they didn't want to go to school the next day because they were frightened of what might happen at the school.
I'm also sort of thinking about the contagion effect as we're talking about it now, and how it has a very negative connotation. However, I wonder if the same social psychological principle could be used in sort of a positive way, Betsy, much in the way you were sort of talking about. And
it absolutely occurs the reverse as well.
Yeah, I'm sifting through my memory to see if I have the term for it, and I can't think of what the reverse of it is. Are any of you familiar with?
I think
is
it's
it the
still
contagion effect the other way?
It's
interesting.
And I believe there was a book on a similar, that with just general trends in
Sure.
Culture.
Sure. Okay. Thank you. I guess going back to some of the barriers that had been alluded to, what do each of you see as sort of the big barriers in this community to accessing mental health?
The biggest barrier is stigma. Do you want to address anything beyond that?
I would certainly agree with that. I think, and because we're a very unique community in that we're a rural community and we're very small. And most of us can walk into the grocery store and likely run into a handful of people that we've seen or met or have some kind of encounter with. And I think that can be intimidating to seek support, knowing that you will likely run into your support in the community. What could happen if you ran into the support in the community, or what if someone saw you speaking with your support in the community, and how that could be perceived or relayed. So I think stigma is the result of being a unique rural community. And at the same time, again, that's why we're here, to assist in destigmatizing the need to seek support, and the fact that we could all benefit from seeking support if we haven't already. And I think just in part of my education and part of my training, we went through support systems to get to the point where we could be healthy enough to acknowledge our own signs, our own risks, our own limitations, our own insecurities, our own inadequacies, to be able to address that prior to working with others. So I think sometimes coming forth is more courageous in some ways.
I think resources is also a big issue in this town. There's waiting lists to get into certain places, and if somebody is in a mental health crisis and you have to wait to see somebody, that's just, for me, it's unacceptable. And can you imagine if you need someone to talk to right there, and then there's no one to talk to, and they give you an intake packet, right, fill this out, and come back in a week, and then you have to see this person, you have to go to another person. I think that can be a difficult challenge for anybody, let alone someone who's in crisis. So I think that's one of the needs that needs to be addressed in town as well.
Do you mind if I just piggyback off that for a second? Thank you, Cheyenne. That's a really good point. And I think it's the insurance accessibility for some folks. It's very difficult to be a Medi-Cal provider. It's incredibly challenging for agencies, not to mention our private practitioners. So I think it really limits our community's motivation to enroll as Medi-Cal providers. So we have very limited, particularly Medi-Cal resources, and yet we have a very large population that are Medi-Cal recipients. So just making sure that we balance our resources with our insurance recipients, I think has been a challenge in this town.
Is there any in for an organization like TRIP to help out with that process in any way?
That's a really good question. There are so many opportunities, I think, for all of us to sit down and help. And I think that collaboration started with a mental health forum that began in 3 years ago, and we just actually had our third forum 2 weeks ago. And the mental health forum has actually been hosted at South Tahoe High, and the purpose has been to gather community members and agencies to sit down and talk about, okay, what are our resources? How can we continue to expand our resources? How can our resources work with one another to fill gaps within the community, and what are those gaps, and how can we supplement the resources that we already have. So the conversation's on the table, and anytime anyone is interested in being more involved, we do have a mental health coalition and a cooperative that has recently been developed and created, and we are hosting these forums. I don't recall our next forum, but I think it's a spring. I think it's in March. So every 6 months we come together, and we try to remain very solution focused and task oriented, with timelines of being able to implement things that we can potentially continue to add. So if anyone's interested, I'd be happy to speak to them more about that.
And I'll take it to a more personal level. A lot of mental health goes undertreated or untreated because of the stigma issues. Can I just ask a question? I didn't ask this. I spoke to the Rotary last week, and I didn't ask this of them. They're a little bit older crowd. I'm going to ask you a really personal question, and I'm going to see where you guys are at with this. How many of you have ever had thoughts of ending your own life? My guess is that a lot more than the people that raised their hand. Almost all of us have thoughts at that time. Almost all of us have periods of depression and anxiety, sometimes not to the level that needs my level of intervention or even Betsy's level of intervention. We all have that. How many of you would be willing to share that with a friend? How many of you would be willing to say, hey, if you ever have these thoughts or if you are ever struggling, I'm someone you can talk to? How many of you would be okay with that? Most of you, okay? I think we need to get to a culture in which talking about our own issues isn't seen as defective or you're crazy or something along those lines. I think we all need to get to that level. And I liken it to, you know, the fire departments where they put signs up that says, you can leave your baby here safely if you need to leave your baby. I think we need to do that personally. I'm the person that you can come and talk to. I'm the person that you can be safe with. And if I don't know the answer, I'm going to work with you. I'll work by your side to get you to the people who do. I'll get you the help. If we all did that collectively for everyone we knew, for our families, for our friends, for our coworkers, we would reduce suicide and we would reduce the violence that we see. Because most of the people that are experiencing those thoughts and do those behaviors are isolating and they think they're alone in these experiences. They're not, as evidenced by those of you who raised your hand.
I want to go back in the conversation for just a minute, but thank you for that point. I think it's a very poignant one. But to Cheyenne for a moment here, you had talked about the waiting lists at times and how frustrating not only as a provider, but as a community member that can really be. Perhaps it's a good place to ask, do you think that there are national resources that perhaps are being underutilized in any way?
What do you mean by national? Like,
well, to kind of, I guess what comes to mind initially is crisis lines. Not to say that that's the solution to everything. Do you find barriers in access to mental health because people are unwilling to pick up the phone? Do you hear of any national programs coming through that could potentially change the wait list so that people get served more quickly?
well, I think I just had this conversation today. We have a crisis line, and over the years, it's been utilized less and less and less. And when we look at our phone records, we are getting calls that are from all over the country. And so on our end, for Tahoe Youth and Family Services, if you look at a crisis line, we're like number 6, like if you Google it. And so I think that's why we personally get calls from across the country, but they go to like a crisis center and then they're kind of jetted out to different agencies of which is appropriate. I think now, especially with the younger generation, you need more of like a text help line. You know, I think you'd get more feedback. I think the younger generation feels more comfortable texting. Yes, and that's something I would prefer, like our agency, to change, because I think we would get more people, young people, that would talk to us that way. But
And maybe it's a good opportunity to plug the number as well.
Absolutely. And I'm not sure, like through Facebook or social media is kind of the route that everybody's going these days, because you can kind of be anonymous. Instead of like picking up the phone and calling, I think people are just a little bit more scared to do that compared to if you could like text or not like Facebook or something like that, to where you're not so, you don't feel like someone can see you or know you, and it just feels more anonymous and you can be talking more openly.
Absolutely. Any other points? Okay. I'd mentioned earlier on in kind of the overview that mental health is such a prevalent issue for, I think, each and every one of us. And I'm sort of thinking about, with so many people experiencing discomfort in their lives, how do we as individual community members show compassion to people who are in a difficult spot in life? What would you say to somebody with regards to compassion?
I was actually thinking this a minute ago, and I was like, well, I think I'll hold off on saying that because this is the perfect opportunity to say that. Hurt people, period. When we are suffering, when we are in pain, when we are uncomfortable, we hurt. And when we are hurt, we hurt others, we hurt situations, we hurt ourselves. And, I think with that being said, when we lack the understanding behind and the motive behind some of the actions or words that we may experience from hurt people, it's difficult to have compassion. It's not because we don't want to have compassion. I don't believe that. I believe it's because we don't understand. We don't have an understanding in order to have compassion. So I think that's another great opportunity about being educated on mental health is it's allowing us to know what signs and symptoms to look out for. It's allowing us to recognize when someone's hurting and to not personalize it, but to rather acknowledge that it may be a deeper, more intrinsic motivating factor for their behavior or their words. And rather coming out and distancing ourselves, actually providing more of a supportive, non-judgmental stance, and demonstrating that compassion, that it's okay to hurt, and that it's okay to seek support, and that we don't have to hurt, and that support is available. And I think that's the benefit of knowledge, right? Knowledge is the ability to be able to make more effective decisions. So the more we know, the more effective we can be, and the more compassionate we can be.
So I often speak in metaphors and tell stories because that's just part of my therapy. So here's one for you. So you come upon a dog in a forest, and you reach out to the dog, and the dog snaps at you. Your immediate response is, the dog is mean, right? And then you notice that the dog's leg is trapped in a bear trap. And suddenly the dog's behavior makes sense. Now, we don't excuse the dog's behavior because snapping at someone who's trying to help you is not very helpful. On the other hand, we have compassion for the dog because we understand its source of pain. And I think we have to look at people who are struggling the same way. They may act out towards us, towards the people who are reaching out to them or offering them help. And it's because they're in such tremendous pain that's where they're at. And we can step back and have compassion for them. And again, it's not justifying or rationalizing their behavior. It's just understanding and have some compassion for it.
And I think people have become more desensitized. I think with TV, movies, video games, if they see this type of behavior, it's almost acceptable. So compassion's kind of thrown out the window because I think it's okay to treat people that way. That's what, I kind of see a lot is people just see it as a normal. And if you see couples or kids that have grown up and their parents have abused each other, and then they are so codependent, and then they start abusing the people that are around them as well in personal relationships and friendship relationships, just because it's generational almost, because they've seen it and they think that's normal. And so again, compassion kind of goes out the window because they've been so desensitized to how they should really react to certain situations.
So I think to follow up on that conversation, what can a community member do when they come across somebody who's experiencing depression or who's having thoughts of hurting themselves? I mean, can you give a couple of concrete takeaways that the audience could use?
So one thing I might say to someone is, people like yourself who are experiencing similar problems have often had thoughts of harming themselves. Are you having these thoughts? I almost always, because I do a lot of crisis work and have done crisis work for a lot of years, somewhat close to some of your ages, actually. So when I get a response with someone, if I ask someone, I often ask this is the question I ask in the ER when I'm doing a 5150 evaluation. I say, a 5150 evaluation is whether someone's mental health issues have gotten to the point that they're a danger to themselves, others, or are gravely disabled, which means that they can't provide for themselves for food, shelter, and general care. So when I'm doing a 5150 examination on someone who's coming in with suicidal ideation and or behaviors, I will ask them, do you want to die or do you not want to feel this way anymore? And most of the time, the response is, I don't want to feel this way anymore. And if I do get the, yeah, I want to die, if I dig some more into that, it's because I don't want to feel this way anymore. And I don't think it's going to change. There's a permanency belief that the way I'm feeling right now is going to be the way it is forever. And I can tell you from my own personal experience that that is not accurate. There is difficulties in life, and there are times that life is pleasant. I'll just give you another analogy because I like to do the analogies. The analogy I have is life is kind of like riding a bike, and there are ups and downs, right? Would everybody agree with that? Riding a bike with flat tires would be tremendously difficult, and that's what life is like for someone with an untreated or undertreated mental health diagnosis. You still have the same ups and downs, it's just that much harder.
Thank you.
And I think I'd just like to conclude with saying that the most important thing we can, I think, say to somebody who comes to us to seek help is thank you. Thank you for, trusting in me. Thank you for trusting in this process. Thank you for your courage. How can I support you?
Also, I think it's very important that everybody in this room knows what services and resources are available. And you would know where to direct this person if they needed it. And so everybody could educate themselves and know what's available out there would greatly benefit you, because you never know when you might become into the situation. And you're like, oh, you know what? You know where you can go. I know where we can help you with that.
So if everyone wants to get their cell phone out, I can give you the 24-hour crisis line. You can type it into your cell phone right now. You have it memorized? No, I don't have it memorized. That's a different one.
There's 1-800-SUICIDE.
I'm talking about our local one, but we'll give you both.
Okay.
So our local crisis line for South Lake Tahoe, which we answer 24 hours a day, 7 days a week, is area code 530-544-2219.
And I've called that number because I put a lot of messages out of what to call, and they did tell me that if that's really more El Dorado County focused or South Lake Tahoe.
It is out.
So there is a
That's
separate Douglas County number.
yes. So thank you for clarifying. That is specific to South Lake Tahoe. We actually have a different crisis line for the Western Slope. Cheyenne's department has a different crisis line, and there are national crisis lines.
And for those of you who may want the national crisis line, if you're just not sure where to direct this person, it's 1-800-273-8255. And if the risk is imminent, meaning if you believe it's beyond needing to contact a crisis line, if you think that it's life-threatening in the moment, and there needs to be immediate response and intervention, you can always call 911. We have a trained crisis intervention team through our sheriff's department, which we're really, really excited about.
We love our sheriff.
And there are trained law enforcement officers that know exactly how to manage mental health crisis. And so you can always call 911 and ask for a welfare check. So if it's beyond crisis number and it's immediate, that's the best approach to take, is asking for a welfare check through the crisis intervention team here through this sheriff's department.
I will just share, every officer in El Dorado County has had crisis intervention training. They got a grant, so every officer's had it. The ones that are specific to South Lake Tahoe that have had the most extensive training have had over 40 hours of that training. They were selected because of their calm demeanor. They will go in and they respond to a situation without escalating it, which is really important. And I will let you know that the state of California has mandated that all officers in the state of California now have some crisis intervention training so that they're not going in with guns blazing and making things worse and or shooting mental health patients.
And for the tech savvy, or for those of you who feel more comfortable recommending an internet resource, there's imalive.com. That's a really good one as well. Let's see here. I've got about 10 minutes left, and I'm sort of weighing which direction to go in next. Maybe since we're kind of sort of on the topic, transitioning over to, let me ask it this way. What effect has the transition to kind of a digital lifestyle or a digital society had on the way in which we view mental health? What are sort of the pros and the cons that you see of having groups on Facebook or YouTube videos or whatever it happens to be?
So I'll just give you an example from my experience in South Lake Tahoe. So I have a daughter who goes to South Lake Tahoe High. I have a son who's at the middle school. And when things in the community happen, they hear about it before I do. For example, we had a suicide last year. One of the boys at the high school committed suicide on a Friday afternoon. I got the call. Now, I run the mental health clinic up here. I got the call at noon on Saturday from the school. My daughter had gotten the information at 8 a.m. that morning. The kids had it at least 4 hours before me. And the same goes with other things. I was at the ER recently doing a crisis evaluation. It was about midnight. They had just gotten another crisis in. It was an adolescent who had attempted suicide, and she wasn't quite medically cleared yet, so the doctor just came out to consult with me. That was at midnight. My daughter at 2 a.m. had the text on that kid. Information with them travels really, really fast. Sometimes they have more accurate information than the sheriffs and than us, which is really frightening. And also a good source of information for me. But there's pros and cons. Good news travels fast, and so does not so good news. So if I'm worried about the contagion effect, and my daughter has the information hours before I get it, there could be suicides long before the professionals are able to intervene.
And on those lines as well, bullying online is huge. It is so crazy. Like, for me, I would be like, just turn it off. But it's their world. That's where they live. And it's not like I'm going to meet you behind the flagpole anymore at 3 o'clock. It's like they've sent out, sexting or texting. And before you know it, there's a picture or something bad about you. And everybody in the entire school knows this. And I think that's a huge challenge right now.
And speaking to the bullying thing, we know statistically that kids who are bullied have incidence of anxiety and depression as adults, and they have a higher incidence of suicide. And the kids who are bullying are diagnosed with antisocial personality disorder.
Thank you for those statistics.
I know. Just full.
And I think from just taking a kind of different perspective and different avenue here and taking it actually all the way back to access to services, one thing we've actually been able to benefit from with the media is telemedicine. Because we lack the services in our community to completely address mental health in person, we've actually started implementing both at Mental Health and Barton telemedicine services. So we have telepsychiatry, where we have contracted psychiatrists both at Mental Health and Barton who provide psychiatric medication management, because we have no psychiatrist in South Lake Tahoe who accepts Medi-Cal. Not one. So we have to outsource our resources sometimes and use telemedicine. That the same goes, we just actually implemented telepsychiatry as well at the community health center, telepsychology as well at the community health center. That actually starts tomorrow. We are contracting with a psychologist to provide Medi-Cal services. So, it there's risks and benefits, such as life, right? There's gains and losses, there's risks and benefits, there's pros and cons. And so I think as damaging as media can be on mental health, it also has its great benefits because we've been able to implement services that wouldn't otherwise be here in the basin.
So I know Facebook is for people who are 20 and older, as my children that are adolescents tell me. I have used Facebook to promote mental health awareness. There's mental health awareness weeks, there's suicide awareness weeks. And I would post, I love TED Talks, I'm a big TED Talks fan. So I would post TED Talks. And after posting something, actually about a book that I highly recommend, it's called Regular and Decaf. If you haven't read that book, it was written by two gentlemen, both had been diagnosed, one with bipolar, one with schizophrenia, and it's their own personal experiences with their diagnoses and their life. Anyway, so I posted a little something on it on Mental Health Awareness Week, and I got several responses from people who said, I left my husband, he was hearing voices, and he had struggled with mental health for many years, and I never told anyone, or other family members. There's an opportunity to open dialogue when you post something of awareness. And again, it's like putting that sign in front of the firehouse that you are a safe person to come and talk to, and be a resource.
There's this great talk about TED Talks. I love TED Talks. If you haven't ever seen them, you need to check them out. There is this one that I watched the other day we did it for the healthy communities that I'm a part of, to let people have a better understanding of how people with mental health issues react to certain things. So imagine if, you know how you have the fight or flight syndrome? Imagine if you were constantly in that fight or flight every single day. So imagine if every day you were like walking into a bear den. And so your emotions are so high and everything's on alert and your adrenaline's pumping. And this is why a lot of times people that have mental health issues have diabetes, heart disease, high blood pressure, because they're always in this state of anxiety. So definitely check out some TED Talks. They have some really, really catchy, well, not catchy, but very educated people that are doing some really good things on TED Talks.
For a list of TED Talks, call me at my office. I'll tell you all the great ones.
Let's see, we've got 5 minutes left. I guess this is more a commentary on the way in which mental health diagnoses, since we're on the topic, has sort of infiltrated our vocabulary. A lot of times you'll hear people say, I was at the party, I couldn't pay attention to anything, I'm so ADD. When in actuality, the person maybe perhaps was just checked out of the conversation or interested in something else. And not to negate the fact that they could truly have it. But what do you think are the positive and the negative effects of the language, the diagnostic language, infiltrating our everyday conversation like that?
To answer that question and kind of elaborate a little bit more on what Cheyenne and Sabrina were saying, one thing I think that's been underreported and undiagnosed for many, many years and misdiagnosed actually is the impact of trauma. And I kind of want to, it goes along with the TED Talks, great TED Talks on trauma right now, everybody. But there's a great study called the ACEs study down in LA through Kaiser Permanente, and it's the Adverse Childhood Experience study. And what they're finding is that there's been a lot of reported symptoms over the course of decades that haven't necessarily been recognized or acknowledged as being the impact of trauma. So I think the benefits of, discussing different things that may seem unrelated to a mental health diagnosis is that we're starting to find out that it's actually very closely related. And as Cheyenne was kind of elaborating a little bit more on, is the physiological symptoms that we experience of anxiety that is potentially the result of trauma. And so, I think that we're starting to start the conversation and looking at things such as somatic symptoms that we have is potentially being the result of something more than just a medical diagnosis, or minimized or not recognized because, it's just a headache or just a stomach ache. So I think the benefits of discussing symptoms more often is that we're actually finding that they could be related to things that we would not have ever known about prior to the research that's taking place right now.
So the TED Talk on ACEs is Nadine Burke. She's a physician out of San Francisco. She's put the ACEs study into good practice at her clinic. She's actually doing screenings for all the individuals that come in. The ACEs study, very briefly, is a 10-question study, and you get a point for every incidence of adverse childhood experience. Those are talking about divorce, talking about having a parent who had a mental health issue, having a parent who had a substance abuse issue, childhood abuse, neglect, sexual abuse. So there's a variety of indicators, and there's a direct correlation with mental health issues, with suicide, with addiction, with physical health issues, all related back to trauma. And I think we're on the cutting edge because what we know about trauma is it changes the physiology of the brain. And it changes how we respond to everything in our environment following the trauma. And I think, like I said, we're on a cutting edge right now of the neurophysiology of trauma and how that's linked to healthcare issues. At our clinic, we still have a big sign outside that says mental health and alcohol and drug. And by the way, that just drives me crazy because alcohol is a drug and it's a huge drug. So having said that, my bosses are looking at changing it to behavioral health. So the sign will eventually change to behavioral health. I'm one step ahead of them. I want to call it brain health because that's really what we're talking about. We're talking about how to keep your brain healthy. And there's a variety of different ways to do it. We also have to look at what's happened in your history because your history is absolutely affecting how you respond to your current circumstances. And we also get a lot out of resiliency too. I can't speak to my colleagues on the panel. I can tell you that I had a lot of adverse childhood trauma that actually promoted my interest in this field and made me, what I am today. So we can take those experiences and actually benefit others. So it's not a doom and gloom, although I love Eeyore, he's one of my favorites. It's not really a doom and gloom scenario. It's really about recognizing that these symptoms are from these events and how do I manage them, and learning how to function better. Or not.
I wonder if we could just talk for a moment about what we sort of mean by trauma, because I think as mental health clinicians, we sort of have an understanding and work in it often. Maybe you could outline a couple of situations or some things that you commonly see in this community that you sort of categorize as a trauma.
So, most of us are familiar with, you probably call it PTSD, right? Post-traumatic stress disorder, most of us are familiar with that from combat veterans or people who have been sexually assaulted. And that's the body's response to that trauma. It's actually changed the physiology of the individual's body, making them on a heightened alert system for future traumas. Trauma can be a big trauma, like a sexual assault or a combat veteran, or it can be a little trauma. It might be a car accident. So if you've ever been in a car accident and then you hear screeching tires later and you kind of have a response, that's what we're talking about, except it can go to a great extreme with that. So traumas can be something minor. For that individual, though, their genetics play a role in that. Their environment, how their environment responds to that stress. Do they tell you, which has been our society, suck it up, big boys don't cry. You want something to cry about? I'll give you something to cry about. Some of you may have heard these things growing up. If you don't have an environment that recognizes when you're suffering or when you're struggling and offers you support, then that can reinforce not asking for help or internalizing that there's something wrong with you for thinking or feeling that way.
And I think specific to our community, I believe sometimes we may underestimate the impact of poverty. And I wish I knew the statistic on our poverty level here in the community. I need to look that up.
Tell you.
Do you know this? What is it?
Well, I know that there's over, it's like 62% of the youth in the school district.
So,
Or on free lunches.
so 62% of the youth in the school district are on free or reduced lunches. I think that's pretty indicative.
Our poverty
of-
rate in El Dorado County as a whole is 13%, or actually, I'd say, take that back. The statistics for El Dorado County are often skewed by our good friends in El Dorado Hills because they make a lot of money. The poverty rate in South Lake Tahoe is 13%. It's a lot of people don't understand. Those of us who live here know there are a lot of big, beautiful homes here that sit unoccupied. Our occupancy rate in South Lake Tahoe is less than 30%. So most of the houses are vacation homes or people's second homes. The people that live here, a lot of the people that live here are in poverty. They're working at the casinos, they're working at the ski resorts, they're doing seasonal work. Some of them are coming over here undocumented, which means that they don't have access to health care and mental health care.
And I think as a result of poverty, we have a little under 300 families living in either multifamily situations or in motel rooms permanently. And if you think about the children associated with these families, these low-income families, they are likely not receiving the nutrition that they need. They're likely not receiving the unconditional love and positive regard that they need. They may not be getting their medical needs met. They are likely not getting their academic needs met because they're not sleeping at night. And they're showing up at school the next day exhausted and unable to retain information. So, that's trauma, So, poverty includes so much trauma. If a parent's working multiple jobs and they're under financial stress because they can't pay their bills, they're going to likely be stressed out. They're likely not going to be equipped with healthy coping mechanisms. Yeah, of course. And as a result, sometimes domestic violence stems from that. So, I think in regards to our community, that is the underlying prevalence of trauma is poverty.
I'm getting the signal over here that it's time for our Q&A. Did you have a...
No, I just told you it'd be difficult to get me to shut up.
All right. We just want to complete our live stream feed, so we'll have this footage available for our trip members, but we really want to thank Tahoe Production House for sponsoring our first live stream. We also want to thank each and every one of our panelists, our speakers, and our moderator. We really appreciate it, and thank you to Lake Tahoe Community College for hosting us. So we're going to drop the mic and open it up to Q&A. So thank you.